Okay, the first thing that we're going to do for the physical assessment, I'm going to knock on the door, make sure it's okay to come in, and then I'm going to close the curtain and provide patient privacy. I'm going to introduce myself. I'm Sailor, and I'll be your nurse today. Can you verify your name and date of birth?
James, 10-6-92.
Okay, I'm going to look at the armband. It's correct. So now that that's over, I'm going to tell him that today we're going to be doing a head-to-toe assessment. You have full privacy for all your medical information, and you can defer any part of the assessment at any time.
Okay.
Okay, now I'm going to perform hand hygiene on the sink. I'm not going to turn it on. Okay, I did that. And now I'm going to make sure that the patient is awake, alert, and oriented at least times 3. So, can you tell me your full name again?
James Pope,
Okay. Can you tell me the year and the month?
September 2021.
Okay. Can you tell me where you are and what we're doing?
Martin Hall, physical assessment.
Okay, good. So, because the patient knew where we were and everything, then that means he's awake, alert, and oriented times 4. In the general survey, his communication was appropriate for his age, and I don't notice any slurred speech. I don't notice any strange speech or anything like that. He's communicating effectively, and he's also dressed for the weather. He's clean, he's groomed, and he is calm. He doesn't seem to be in pain or anything like that. So that being said, we're going to start the eye assessment. So I'm going to inspect the eyes. They're equal bilaterally in their placement on the face. The sclera is white. It's not blue or yellow. I'm going to pull the conjunctiva down, the lower conjunctiva. It is pink and moist. I don't notice any exudate coming out from anywhere on the eye. The eyebrows are equal bilaterally as well. So I'm going to look at his pupil size on my pen light right here. And it seems like his pupils are about 6 right now with the lights on. Now we're going to test their effectiveness to light. So I'm going to turn the lights off. I'm going to ask you to look at a spot on the wall so that the pupils dilate. I'm going to shine the light into his left eye. Okay, and both pupils dilated and went to about a size 3. And let them redilate again. I'm going to shine the light into the right eye. Okay, both pupils dilated again to about a size 3. Now we're going to test accommodation. So I'm going to ask the patient to focus on my finger. And when I push it towards your nose, just keep focusing on it. Okay, good. Both eyes inverted down and in towards the nose, and both pupils dilated once again to about a 3. So that tells me cranial nerves 2, 3, and 4 are intact. So now we're going to do the Snellen chart. We're going to walk into the hallway for that. And while the patient's walking, I'm going to assess his gait, and his gait is normal. Please stand here. The patient is standing 20 feet away from the chart. Okay, now could you cover your right eye for me and read with your left? And I want you to read down the chart until the smallest chart that you can read.
E, F, P, T, O, Z, L, P, E, D, F, E, C, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, F, C, T.
Okay, so the patient's left eye has 20/15 vision. Now could you do the other eye and read with your right eye?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T, F, D, P, L, T, C, E, O.
So in the patient's right eye, he has 20/13 vision. Now could you read with both eyes?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T, F, D, P, L, T, C, E, O. Yeah, I
Okay.
ain't got that last one.
And with both eyes, the patient has 20/13 vision. And I didn't say this before, but I would have asked the patient beforehand if part. If he wore any corrective lenses, like contacts or glasses, and if he did, I would have told him to keep those. Okay, you can keep your thing off. So we're going to do the assessment of the face, specifically the ears now. I'm going to inspect the ears. I'm going to inspect the skin around the ears. I'm looking for any lesions, redness, or bruises, especially behind the ears, where skin breakdown may occur. And there's none noted. The skin's a little more red than the rest of the face. The ears are also equal bilaterally on their placement of the head. They're correctly placed along the outer conjunctiva of the eye. The outer canthus of the eye. I'm going to palpate a little bit. You feel any tenderness?
No.
Like here. Any tenderness?
No.
Okay. The ears were cool to the touch and they were dry. Now we're going to do the nose. Put your mask down. The nose is midline on the face. Both nostrils are symmetrical. Looking for any redness, bruises, lesions, or anything like that. I do know some sprinkles of freckles across the nose, but there's none that are large or concerning. And now I'm going to look into the patient's nostrils. If you tilt your head up. I'm looking at the turbinates, and both nostrils are turbinate, and there's equal hair distribution inside of the nostrils, and the septum is also midline. So now we're going to do the mouth. From looking at the outside of the mouth, the lips are an appropriate color for the patient's ethnicity. They're a pink color. I don't see any redness, swelling, or lesions, and I do note facial hair on the upper lip, the chin, and the cheeks. So if you could open your mouth. Checking buccal mucosa. It's pink, smooth, and moist. The palate is also pink and smooth. Could you lift your tongue? Sublingual area is pink and smooth. All teeth seem to be present. I don't know any bleeding of the gums. I don't know any cavities. Could you stick your tongue out? Say ah.
Ah.
Okay. So the tonsils are present, but they weren't swollen at all. So I would rate them a 1+. The uvula was midline, and it did ascend when the patient said ah, so the vagus nerve is intact. Now I'm going to inspect the neck. I'm looking for symmetry of the neck. And the sternomastoid muscle, I'm looking for any swelling, and there's none noted. The trachea and Adam's apple are midline, and I'm going to palpate the neck. Do you note any pain or irritation with that?
No.
Palpate the trachea. I don't feel any swollen lymph nodes or any swollen glands or anything like that. Now I'm going to inspect with the pen light for a carotid pulsation. Okay. And there's no carotid pulsation noted on either side of the neck. So now I'm going to palpate the carotid artery unilaterally. First I'm going to do the right side, right under the neck in between the trachea and the sternomastoid muscle. The carotid artery it has an even pulsation. I'd rate it a 2+. Now I'm going to do the left side. It has an even pulsation, and I would rate it a 2+. Now I'm going to auscultate for any bruise using the bell of my stethoscope. Okay, I'm going to ask the patient to breathe in, breathe out, and then hold their breath. So you can go ahead and do that. No bury noted on the left carotid. Now I'm going to do the right. So once again, breathe in, breathe out, and hold your breath. No bury noted on the right carotid. Now we're going to do the posterior chest. That's okay, if you don't mind taking your shirt off.
I'm zoned out.
No, you're good. The first thing we're going to do is inspect the posterior chest for any redness, swelling, or bruising, or anything like that, and especially check for moles on the back that the patient might miss. There's one mole noted in between the scapula and the upper back, but it's below 6 millimeters, and it has defined borders, so it shouldn't be a worry. The spine is midline and straight. I don't notice any bruising or swelling. I'm going to palpate the rib cage. Tell me if you feel any tenderness with this. None?
None.
Okay, no tenderness noted, no edema. I'm going to palpate for even expansion of the chest. So just breathe normally. Okay, the chest has an even expansion. So now I'm going to auscultate for breath sounds using a zigzag motion. I'm going to start above the clavicle to auscultate the apex of each lung and work down to the base. So I'm going to ask you to take, I'm using the diaphragm, my stethoscope. I'm going to ask you to take deep breaths.
Okay.
But if you feel dizzy, let me know and we can stop.
All right.
No adventitious breath sounds were noted. All vesicular and bronchovesicular sounds sounded good. Now we're going to do anterior chest. Same thing. I'm going to be inspecting for any bruising. You can sit up for this. Any bruising, swelling, edema. I don't note any. There's no sternal abnormalities. I notice hair distribution on the chest, and the clavicle. The clavicles are symmetrical as well. So I'm going to palpate. Tell me if you feel any tenderness anywhere on your ribs.
All good.
Okay, no tenderness noted, no edema noted. So I'm going to check the patient's respiration rate. I'm going to count for 1 full minute. So you can just breathe normally. Okay, I noted the patient's respiration rate as 16 breaths per minute. Now I'm going to auscultate anterior lung sounds. I'm going to start above the clavicle to auscultate the apex of each lung. So deep breaths for me. If you get dizzy, tell me. Could you lift your arm? Okay, no adventitious lung sounds were noted. All vesicular sounds and bronchovesicular sounded good. Now I'm going to auscultate the heart. I'm going to start with the aortic valve on the second intercostal space on the right side of the chest. So find the sternal notch and walk over. And I should hear S2 louder in this area. And I'm going to listen with my diaphragm at first to note any extra heart sounds like S3 or S4. Okay, no extra heart sounds noted. The beat was even and regular. Now I'm going to do pulmonic valve, which is on the second intercostal space on the left side of the chest. I should hear S1 louder. I'm sorry, I should hear S2 louder for this one. Okay, beat was even and no extra heart sounds noted. I'm going to do Erb's point, which is third intercostal space on the sternal border. S1 and S2 are about even here. The rate is even and no extra heart sounds noted. I'm going to do tricuspid valve on the fifth intercostal space on the sternal border. S1 should be louder here. Okay, beat was even and the rhythm was even and no extra heart sounds noted. Now I'm going to do mitral valve, which is also where the apical pulse is on the fifth intercostal space, mid-clavicular line, right about here. S1 should be louder. Okay, rate was even and no extra heart sounds were noted. Now I'm going to listen for murmurs with the bell of my stethoscope, starting from the bottom going up. So I'm going to start back with the mitral valve. No murmurs noted. I'm going to do tricuspid. No murmurs noted. Erb's point. No murmurs noted. And then pulmonic. No murmurs noted. And aortic. No murmurs noted. So now we're going to assess the upper extremities. I'm going to inspect them for symmetry. The arms look symmetrical. The muscle tone looks even. No notable places of atrophy or anything like that. I'm going to look at the hands. I don't know any cyanosis or redness or anything. And I'm going to palpate. The skin is dry and warm to the touch. I'm going to test, and I don't notice clubbing in the fingers. And now I'm going to test capillary refill on all 10 fingers. I'm going to push the finger until it blanches, and the blood should return in less than 2 seconds. Okay, capillary refill was less than 2 seconds in the right hand. I'm sorry, in the right hand. And capillary refill was less than 2 seconds in the left hand as well. Now we're going to do strength. Can you squeeze of the fingers? Can you squeeze my fingers? Okay, now can you try and spread your fingers against force? Good. I'd rate the strength 5 in the fingers. Could you flex your hands against mine, like try to push my hands down? Like this.
No.
Okay. Or I'll pull up, sorry. Okay. I would rate it 5 in the hands. You do your hands like this. Pull towards you. And then push. Good job. I'd rate the arms 5. Now try to shrug your shoulders. Good. I'd rate the shoulders 5. Now we're going to do range of motion. Can you flex your fingers? This. Extend. And then put them together and spread them. Okay, good. Full range of motion in fingers. Can you flex the wrist? Extend. Then can you do radial deviation inward and ulnar outward? Full range of motion in the hand. Can you flex your elbows? Extend. Full range of motion in elbows. And shoulders, we're going to do flexion. Can you hold your arms in front of you and go over your head as high as you can? Good. Can you put them behind your back as far as you can? Good. Adduction, can you cross each arm in front of your body? Good. And then abduction, can you do your arms out to the side as high as you can? Good. Full range of motion in the shoulders. Now we're going to do abdominal, so you can lay down. I'm going to inspect the abdomen. I'm going to inspect its shape from the side. And the abdomen is flat, which is good. I'm going to inspect from above, make sure everything's symmetrical. And it is. Both sides of the abdomen are symmetrical. I note hair distribution down the midline. The umbilicus is inverted in midline, and I don't note any obvious masses. So now I'm going to auscultate the abdomen, starting in the right lower quadrant, using the diaphragm of my stethoscope. Right lower quadrant is normoactive. Right upper quadrant. Right upper quadrant is normoactive. Left upper quadrant. Okay. Left upper quadrant is also normoactive, and then left lower quadrant. Left lower quadrant is also normoactive. I should have done this before auscultation, but I'm going to inspect for an aortic pulsation with my pen light. Okay, the patient does have an aortic pulsation, but he doesn't have an excess of subcutaneous tissue, so this could be a normal finding for him. I'm now going to palpate lightly with a circular motion, 2 fingers, 1 centimeter in the right lower. Let me know if there's any pain or tenderness with this.
Okay.
None?
None.
Okay, no pain noted, no palpable masses or organs. Now we're going to do deep palpation with 2 hands, 5 to 8 centimeters. Tell me if there's any pain. None?
None.
Okay, no pain noted, no palpable organs or masses there. And then we would do inguinal area. We're going to defer from this today, but there I would palpate the femoral pulse, and I would palpate between the pubic bone and the iliac crest to do that. Okay, now we're going to start lower extremities, but in the previous clip I did forget to do the pulses of the upper extremities, so I'm going to do those now. I palpate the radial pulse on the thumb side bilaterally. 2 fingers. Okay, the pulse is even bilaterally, and I'm rated to 2+. Now I'll do brachial. Okay, the brachial pulse is even bilaterally, and I'm rated to 2+. So now we're going to go back to lower extremities. I'm going to note, do you think you could pull your jeans up a little bit? I'm going to inspect the legs, the muscle tone, it seems about even, no obvious atrophy. Could you take your socks off too? And I'm going to note the color. I don't see any cyanosis. I don't see any redness that could be indicative of like a deep vein thrombosis. There is hair distribution on the legs. I don't notice that there's any swelling or anything in the knees. So I'm going to palpate just to feel the warmth. The legs are warm to the touch and dry. I'm going to palpate for edema. I don't know if they can see this. Okay, I'm going to palpate using my thumb right on top of the tibia. And there's no edema present. I rate that as 0. Okay, I'm going to inspect the feet and in between the toes where skin breakdown could happen on the bottom of the feet. I don't note any lesions, bruising, redness, cyanosis. I'm going to check capillary refill on all 10 toes. We want it to be below 2 seconds. I think they can see. Let me put you down here. Okay. All capillary refill on the right foot was below 2 seconds. Okay, all capillary refill on the left foot was also below 2 seconds. Now I'm going to palpate the lower extremity pulses. First I'm going to do brachial bilaterally, which is behind the knee. I'm going to pull up. Here, you can relax. I'm going to pull the legs up a little bit with a lot of pressure and then let go a little bit. Okay, brachial pulses are even bilaterally, and I'd rate them a 2+. Now we're going to do posterior tibialis. I hope this is easier to see. Which are going to be, crap, I'll do you down here. Which are going to be the inside of the ankles, right in front of this tendon. Okay, posterior tibialis is equal bilaterally. Now I would rate it a 2+. Now we're going to do dorsalis pedis, which is right above the middle toe right here. Okay, dorsalis pedis is equal bilaterally, and I'd rate it a 2+. Now we're going to do the strength of the legs. I'm going to do the strength of the feet, so can you push down against my hands? Okay, can you push up against my hands? Okay, I'd rate the feet a 5. Now can you pull in towards yourself? Okay, can you push? Okay, I'd rate the leg strength a 5. And now we're going to do range of motion. So you could spread your toes, wiggle your toes. Okay, full range of motion for the toes. Could you dorsiflex your feet up? Could you plantar flex? Full range of motion for the ankles. Could you extend your knees out? Flex your knees in? Full range of motion for the knees. And then could you lay down for the hip? Okay. So could you pull your knees in towards your chest? Okay. Good flexion for the hip. You can put it back down. Could you pick up one leg and then put your other leg underneath that leg for adduction, and then the other way? Okay, and then could you, one leg at a time, pull your leg out as far from your body as you can, and then the other leg? Okay, good job. Now stand back up, please. And now could you push your leg back behind you as far as you can? Okay, other leg. You just keep your spine stable. And just push. Okay. Full range of motion for the hips. Now we're going to do, can you go side to side for spine range of motion? Full range of motion for the spine. Can you lean back as far as you can? Good. And then I'm going to ask you to bend forward and touch your toes this way. And while he does this, I'm going to assess his scoliosis. Do his scoliosis assessment. The patient's shoulders are not, he doesn't have a rib hump, and the shoulders are even, so that's a negative scoliosis and full range of motion for the spine. That's good. And then I would tell him if he needed anything to call me, and that would be it.